All right, guys, let's have the exciting conversation I know you all want to have. It's about non-surgical joint pain relief. We're going to start with the knee. I know we've seen lots of patients come in over the last 20 years with knee pain, shoulder pain, neck pain, back pain. But I'm going to go over some really easy strategies to avoid knee surgery. We've looked at some of the research. Some of the Harvard studies even say that only about 17% of all knee surgeries are actually necessary, and even less than that successful. So there are definitely times when knee surgery is successful, and we've got some great orthopedics we can refer you to if that's the case. But let's talk about non-surgical knee pain. So if you got knee pain, or you know somebody has knee pain and you want to see if we can help them along without having surgery, let's talk about that. So here's the knee. Let's run through a couple things on the anatomy. Right here's the patella, that's your kneecap. You got a tendon on top of it, you got a tendon below it. And then what most people tend to hurt are these little squishy pads right here. These are called the meniscus. And then you have another band on the inside. You've got these a medial collateral and a lateral collateral ligament. And that's the majority of what we see where people have injuries with. A lot of things that we see right now, especially if you're over 40 and you're an athlete or you've had a poor diet, then you can develop arthritis. You've probably heard of osteoarthritis and rheumatoid arthritis. Osteoarthritis is what we mainly treat, but what we look for is the space between the knee joint. We want to see these be even, and we want to see the space behind this patella. We want to see that be even also. So if you start to lose some height on the outside of the knee, then we want to address that. If you start to lose some height on the inside of the knee, then we want to address that. But most of the time what you feel is like either when you're walking down steps, you get a sharp pain, or first thing in the morning, those joints get really tough to move, in particular the knee. Or if you put heavy weight bearing on it, the knee will start to hurt. Or what we see a lot of is if you wear either a certain type of shoe or you're on cobblestone and you're kind of on uneven pavement, then you start to get knee pain. And the reason that happens is because these joint spaces, as they become thinner from osteoarthritis or degeneration, there's a lot of nerves in here, and these actually start to touch. It's technically not bone on bone, but it feels like bone on bone. So a lot of times if that's the case, we'll take an x-ray and see what's going on. But what people don't really realize when it comes to knee pain is that something as simple sometimes as what we call an unloading brace helps a lot. Because if this starts to compress, either on the inside or the outside, if this starts to compress and it hits those nerves in there, most braces are designed to find out where that is, and we can measure for it if we have to, and we can unload that joint and take the pressure off where those nerves are, and the pain goes away. And then let it heal on its own. You can do some rest, some ice, some compression, elevation. We call that RICE. That's the initial treatment. Anti-inflammatories work. I prefer all natural anti-inflammatories like curcumin and turmeric. Those are fantastic, all natural ones. You can get another one on Amazon called Multiflex. These are really good. Chondroitin sulfate helps also, but these are really good anti-inflammatories, especially for the small joints. I highly recommend you try those for at least 4 to 6 weeks. Here's another thing though, is stretching. Most people think that since my knee hurts, stretching and exercise, I should stop doing that. Now, if you're doing the stretch or you're doing the exercise and it does hurt, then by all means you stop that. But for the most part, you've got your quadriceps that connect to the front, then you got your hamstrings that connect in the back. You want to stretch your hamstrings. You want to exercise your quadriceps. You want to get some movement back into this joint, maybe not heavy weight bearing, but we do want to exercise this joint, and we want to get some synovial fluid going through here. And if you start to get a little inflammation, that's not always the worst thing. Sometimes you have to have a little inflammation to trigger a healing response in the body. Those are some basic things we can do in here that are non-surgical, super easy. You can do them on your own. You can Google a million ways to do your stretching exercises. Now, if they don't work, we still have other options that are non-surgical. One of the ones that I like that we've done and we've got great results with is called hyaluronic acid. Now, hyaluronic acid is an all-natural substance. We use it in the face and aesthetics a lot. And even some insurance has covered this. With a hyaluronic acid, we'll actually inject these into these joints here. Now, this is pretty cool. Get this. This is how the knee joint works. There's actually a really thick covering over the knee joint, and that's called the capsule. So the joint capsule is really tight fibrous tissue, and it's airtight, and it connects this knee joint. But inside of this, you've got synovial fluid. Now, it's hydrostatic, and what that means is that the reason why you got so much fluid inside of a knee joint is because when you take fluid and you compress it, it doesn't compress any further. So if you have this knee joint, let's say the whole ocean was made out of the knee joint fluid, and you dropped a boat on it, when it hits the water, it would tip over. You can't compress this fluid any further. So when you put things like hyaluronic acid in, then it tends to fall into the bottom, and it actually expands this joint capsule, and it can add to the cushioning in the joints, and it's fantastic. So if you're feeling that compression, and we don't want to get surgery, and we look on the x-ray and we see some compression there, hyaluronic acid is an option for us in here, especially if it's some of the tissue that we're losing some of the cushion on. The next thing, if that doesn't work, what really has phenomenal results, which is one of my favorite treatments, I've already done this in the shoulder, is PRP. So PRP stands for platelet-rich plasma. And it's a super simple technique. We just take the blood out, we spin it, we pull the growth factors out, so it's your own blood. There's no chance of rejection here. And what we do is we take the enzymes and the proteins and all the little healing salts and electrolytes that are in this fluid here, and this is what your body naturally uses to heal parts of it, but now we've just condensed it by like tenfold, and we can inject that into the knee. And in particular areas where we see where the damage is, we can do this with an ultrasound, we can do this with a fluoroscope and get right into where actually the damage is, and it triggers an inflammatory response. And it causes the body to trigger back into healing mode. And all this fluid in here with PRP just has phenomenal research on how it's regenerative. It actually can take tissue that's been broken down and reverse the aging process itself. So PRP is a great one. It's one of my favorites. There's no side effects with this at all, especially if it's done in a clean environment with somebody who's experienced on how to do it. And if that doesn't work, the last option that we have for non-surgical is stem cell. Now, you probably have heard stem cell all over, a lot of different things about stem cell. The stem cells that we use, they're non-fetal, meaning that it's only coming from umbilical cord, it's only coming from donated tissue. But what's amazing about the stem cell is that when you put stem cells in, we can put in between 1, 5, 10, and 50 million concentrations of stem cells into the joints, specifically where the damage is. And what these do, it turns the healing factors on within your own stem cells for them to create a massive healing response. So if you think of a stem cell, a lot of people think of stem cells as, well, they're blank, we'll put them in and it just turns into the new cell. It doesn't really work that way. The best way to think of a stem cell is this, is if you ever had an old dog, like an old golden retriever, think of that. And then you bring like 15, 20 brand new energetic puppies around that old golden retriever. That old golden retriever kind of wakes up and you see him kind of wake up a little bit. That's kind of how stem cells work. When you bring these new fresh stem cells in and you put them into the knee joint or the shoulder joint or wherever it's injured, then it makes an up-regulation of your own stem cells, and that's where you start to see the healing. And we can do before and after x-rays, and we can see the joint space come back, we can see the arthritis reverse, we can see the movement start to get better, we can see the pain go away, and those are just some of the simplest ways to handle knee pain if you want to do it non-surgically. So if you have any questions, feel free to text me, or if you want to set up a consultation, click that button below and set up a free consultation.